KRCG, MU Healthcare, and Capital Region Medical Center present a special focus on your health. Navigating the vaccine begins now.
And good evening once again. Welcome to this special broadcast of Focus on Your Health, Navigating the Vaccine. I am joined now by Teresa Snow from MU Healthcare and by a panel of doctors. We have gathered to answer your questions about the COVID-19 vaccine.
And we know you have many of them, so we'll get into it. So far in Missouri, the Department of Health and Senior Services dashboard says that nearly 158,000 Missourians have received 2 doses. They've been completely vaccinated for COVID-19. Almost 563,000 people have received their first dose of vaccine. Now, of those, some 14,000 have received their doses at MU Healthcare and affiliate Capital Region Medical Center. Following the state's guidance, those eligible so far right now include residents and personnel at senior living facilities and care facilities, healthcare providers, first responders, people age 65 and older, and those who are considered high risk for illness. But of course, that leaves hundreds of thousands of more Missourians waiting in lines, many of whom are unsure about the vaccine.
At the state level, it is the policymakers in Jefferson City and the healthcare providers across the state who must manage the effort to get the COVID vaccine to us. The logistics of distribution, even the politics of the situation are one challenge. But we focus tonight on the psychology of vaccine acceptance by healthcare consumers. We'll begin by hearing from the people who run MU Healthcare and Capital Region Medical Center.
One of the amazing things to me as a physician and as a scientist is the speed at which the vaccination models were produced in the United States and throughout the world. To be able to have 2 vaccines already FDA approved and being in use and several more on the way in the next few months is an astonishing scientific feat.
True, the people in Washington called it Operation Warp Speed, but it's that very success in beating the clock and calendar that gives some people concern. Did we really jump through all those hoops? Is the stuff really safe?
I'm 100% confident that the science was sound and these vaccine products are very safe. I've looked at the data, and it's incredible how few side effects there actually were, particularly serious side effects, extremely, extremely rare. And I don't think anyone needs to be fearful of having a vaccine. To me, it doesn't make any sense not to get vaccinated.
Just as with the testing, the vaccination process has been set up along strict protocols, and Mid-Missouri providers have followed them.
We first vaccinated our employees, and that process went very well. Not only did we vaccinate our employees, but other health caregivers in the community, JCMG for their initial shot, as well as dentists and other healthcare providers that are in and around Jefferson City. Now we're focused towards the public.
And that means clever strategies, both for public notification of vaccine availability and for getting the most needles in the most arms through mass vaccination clinics. And yes, the bosses have heard the complaints about the rollout.
We do know that this is a supply and demand issue, and I'm not casting blame or disparaging in any way, shape, or form. The federal government, the state government, they're doing everything they possibly can to get the resources that are here. But that being said, I do believe that if we were able to have additional vaccine, that we could vaccinate more and more Missourians in an incredibly efficient manner.
Well, before we get to your questions, we want to hear from the people who've already had the vaccine. What did it feel like? How did they feel afterwards? A mix of doctors, nurses, and patients share their experiences with us.
The day of it, it was pretty painless. Didn't really feel it going in.
Absolutely painless. Even the needle, I didn't feel the guy stick me with a needle.
The most painless shot I've ever had. I couldn't feel it at all.
It was very easy getting the vaccine.
It was very much like the flu shot, not much different at all. A little bit of soreness the first 24 hours on the first round.
I felt fine that night. The next day I woke up, my arm was a little bit sore. I was a little bit tired that day, but for the most part, I felt fine.
And afterwards, mostly my arm was sore for a few days, and no real large side effects with it.
but basically all I had was soreness and a mild headache with either shot.
The second round was a little bit more. At the 24-hour mark, it was sore.
If you can protect yourself, and knowing that you protect yourself, you also protect others, then that's a good reason enough, I think, to get it.
Absolutely get it. It will protect you, and it will help us reach herd immunity, which things can really not get back to normal until we get to that point. So for yourself and for your family, your community, your state, your country, get the vaccine.
I've had some close friends lose family members, and I've seen the tragedy of hearing their story of their father getting sicker and passing away. And if we can stop that from happening to other families, I think that's very important.
Well, if you haven't yet received your vaccine, grab a pen and a piece of paper because we want to tell you how to learn about vaccine availability in your area. I want to explain how you can be updated because both hospitals have different procedures. Of course, at both facilities, you must be eligible. That's according to Missouri's tiered distribution plan. We are currently in phase 1B. Tier 2. At MU Healthcare in Columbia, you'll need to take a survey on our website. It's muhealth.org. If you don't have internet access or you need help completing that simple form, we have a number for you to call. It is 573-771-CARE. That's 573-771-CARE or 2273. Everyone can do this. It is not just for MU Healthcare patients. All vaccinations in Columbia are taking place at Furrow Field. They are by appointment only. Now, if you're closer to Jefferson City or a patient of Capital Region Medical Center, you'll need to call your healthcare provider to sign up for a vaccine. Again, as long as you fall within the state's eligibility guidelines. If you do not have a primary care provider with Capital Region Medical Center, you will need to establish care first. For help finding a doctor, go to their website. It is visit crmc.org/provider-directory. Again, all vaccinations are by appointment only. Now, we want to introduce you to the doctors joining us tonight. Dr. Laura Morris is a primary care physician in Fulton, Missouri. She's also co-chair of MU Healthcare's COVID-19 Vaccine Committee. Dr. Randall Haight serves as Vice President of Medical Affairs for Capital Region Medical Center in Jefferson City. Thank you both for joining us.
Indeed, thank you. From you folks at home, we have already received dozens of questions over the past week. Keep them coming. You can submit your questions through a form on our website, krcgtv.com, or on our Facebook page. If we don't get to your question on air, we will do our best to answer you online. Dr. Margaret Day will be joining us online on Facebook to answer questions. Dr. Day is a family medicine physician and also co-chair of MU Healthcare's COVID-19 Vaccine Committee. So now let's get to the questions. Teresa, why don't you get us started?
Thank you very much. We had so many submitted in advance, and we're going to hit those first. I'll start with Dr. Laura Morris. How long is the vaccine good for? How often will we need to get it?
That's a great question, and honestly, I wish we knew the answer completely 100%. We know, based on the studies that have been done so far, that the folks who got the vaccine in the beginning of those trials, that's been at least 6 months for some, and the immunity is still good. If we will need to get the vaccine repeatedly, sort of a booster like a flu shot, is yet to be determined. We know the immunity will last long enough to protect us and get us out of the situation we're in now, and more research will need to be done.
Well, after you've received both vaccinations, do you still have to quarantine if you're exposed to COVID-19?
So right now, the recommendations have not changed. I think that's what we're all looking forward to and what we're all hoping for. But right now, not enough people are vaccinated, and we don't know enough yet about how completely the vaccine prevents asymptomatic transmission to change those guidelines just yet. So folks that would have been exposed will still need to follow public health guidance and quarantine and wear masks and all of those things.
Dr. Haight, Stephen from Jefferson City asks, once I get my shots, what exactly does that mean? Can I be more social with my kids, my grandkids, having them over to the house? When I go to the grocery store, I assume I should still be masked and wear a mask in public.
Yes, even though you've received your vaccine and even after your second vaccine, you need to continue to do the things that the CDC recommends and that we are recommending. Continue to wear your mask when you're out and about. We also want you to physically distance from one another when you're out and about as well. When you go and visit friends and family, make sure that they are healthy, make sure that everyone is taking care of themselves, and again, enjoy each other's company, but you may want to be a little bit further apart than what you may have been a year ago.
Dr. Haight, if you've had COVID and you're still showing antibodies, why are some people recommending you still get the vaccine?
So we recommend that you continue to take care of yourselves, but we also want you to get the vaccine. Again, the study's being done to show immunity once you've had COVID. We're doing those as well as getting the vaccine on top of if you've had the COVID as well. So we are encouraging people, even though you may have had COVID, once you're free of the disease and asymptomatic, to go ahead, get signed up for the vaccine, as we think that will be the most beneficial for you and protect you the most.
Everybody wants to know about the exceptions. Dr. Morris, one person is asking, is the vaccine effective for those with a compromised immune system? Should they get it?
Yes, and in fact, folks with a compromised immune system are at an increased risk for severe COVID and severe disease. So absolutely, those are folks we want to get the vaccine. You know, it's true that depending on the disease or condition a person might have, their immune system might not respond as strongly, but that's still really important protection. And so absolutely, folks with immunocompromising conditions or autoimmune diseases should definitely get the vaccine.
I'll let you both answer the next one because we've given doses in Columbia and in Jefferson City, but there aren't enough for everyone. Several people have submitted questions asking, how is it determined who gets the vaccine? They've submitted their information online on every form they can find, and there are multiple ones, and they believe they're eligible, yet they're not being called.
Well, I can answer this one first. I know that absolutely folks are out there looking for vaccine in every nook and cranny, and at MU Healthcare we have a long list and a short supply. So this is really simply a supply and demand issue, and I encourage those folks to keep their names on those lists and jump at the chance when their opportunity comes up. But the reality is we just need more supply so that we can get those shots in arms. So at Capital Region,
Dr. Haight?
We are experiencing the same thing. We have a shortage of vaccine available to us, and so we have asked each of our patients to contact their physician, either their primary care physician or their specialist, to be screened to make sure that they qualify for the vaccine, and then we give those names to our schedulers who are making the calls. And so when we find out how much vaccine that we have available on a certain day, we have the schedulers going through that list of people who qualify according to what the state has recommended to receive the vaccine. Again, as Dr. Morris said, we have a very short supply and a much larger number of patients who are needing the vaccine.
Let's put some numbers to it. First, Dr. Haight, tell me how many doses Capital Region gave in the latest vaccination clinic.
So we have been giving vaccinations, and we have a plan for 800 vaccines to be given over the next 2 days at Capital Region. Total, since we have been giving vaccinations for healthcare workers as well as for our patients, we've given between 4,000 and 5,000 doses to patients, and many of those are coming up to their second vaccine at the end of this week on Friday and Saturday.
Dr. Morris, give us a sense of what MU Healthcare has given at that Faroe Field site.
That Faroe Field site is pretty impressive. You know, when folks get up there, they tell us how efficient the process was and how smooth the process was. And in fact, we were able to give over 2,000 doses on each of our last two high throughput clinics, the last Thursday and Saturday, despite the snow. Not a single dose wasted and over 2,000 shots given each day.
And clearly not enough for everyone who wants them. One last question here. I'll send it back to Dr. Morris. How can we be sure that at our second dose, at the appointment, that our second dose will be there for us?
That is a common concern and actually has not been a problem at all. So the federal government is holding the supply in such a way that when your first dose is sent and you get that shot in your arm, it's guaranteed that the second dose will arrive at the same site, the same clinic or location where you got your first shot, and it'll arrive at the right time. So depending on the type of vaccine, either 3 weeks later for Pfizer or 4 weeks later for Moderna, and that has not been an issue. So if you get the first shot, there's a second one coming.
Kermit?
Just a reminder, you can keep on submitting your questions through a form on our website, krcgtv.com, or on our Facebook page. If we do not get to your question on air, and I'm sure there will be many that we don't get to, we will do our best to answer it online. Now, the first COVID-19 variant was detected in the United Kingdom in September. In the United States, it has found its way into 36 states, and over the weekend, Missouri health officials reported the first case of the variant in the Show Me State. KRCG 13's Jessica Hart runs down what we know about the variants.
5 months after the first COVID-19 variant was discovered in Europe, that same strain has been detected in Missouri for the first time.
The reason why they're different is that they tend to be passed on easier.
Dr. Christella Budo is an infectious disease expert with MU Healthcare. She says the COVID-19 virus can only mutate while it spreads and says we'll likely see more variants.
So when the virus is copying its own genetic material, it makes mistakes. And all of our cells do that, but with more advanced cells like human cells, there is more checks and balances to make sure that that copy truly reflects the original. Every time they make a copy, there's a change that happens, and over time that change can be significant, and the virus can look different than what was originally intended to be copied.
Budo says each mutation made when the virus copies gets it closer to becoming something new.
What this means is that there are probably more variants that we will discover. And the more variation we have in a virus, the more likely is that we're going to get to a point where it is a completely different virus, that we have to change some of the strategies that we currently have to combat it. So far, they haven't been different enough for us to change any of our strategies, but that's the real fear.
But Budo says we aren't defenseless against these new variants.
As far as we know, yes, they have tested the UK variant with the vaccine and showed that it is still effective. However, it seems that people may just need a higher level of antibodies or response for that to work. But so far, the evidence is pointing towards they still work.
And she still recommends people getting the vaccine, citing evidence of an already decreasing number of people with severe COVID-19 illness.
The goal is not only to prevent people from getting really sick, but also to see a decrease in transmission. And when we see a decrease in transmission, we will see a decrease in the virus's ability to replicate, which would then lead to less variants that we will over time see. At least that's the theory.
Dr. Budo says the more people we can get vaccinated quicker, the better it will be in terms of controlling the variants. She acknowledged there is a theory the variants cause more hospitalizations and more deaths, which she says has yet to be well defined.
So we heard just today from Dr. Randall Williams at the State Health Department that there is still just the one case of the UK variant that has been isolated in Marion County, Missouri, but that doesn't mean it'll stay there. So the first question, I guess, is because it is on so many people's minds, Dr. Budo touched on it in the story, is the vaccine good for multiple strains of this virus? Dr. Haight?
So there are many variants that you may have heard about. The UK is one, and the vaccines appear to be very effective against the UK variant. There's also the South African as well as the Brazil, and those are being studied about how effective the vaccines are. Depending on the variant, it is thought that the vaccine, if not as effective as it is against the UK and our current variant, it will still be very effective to help these others as well. But again, they're being studied right now.
So those are the variants we know about, and it occurs to me that a lot of people are probably looking at this the same way they look at influenza, that every year you go and get a shot. There are a couple of different strains identified for that particular shot that year. You hope they have guessed right, and you hope that you are protected from influenza. Is that what we can expect going forward with this coronavirus vaccine, that there will be new strains and new shots, and it might be a guessing game going forward?
So I can answer that one. I think that's a possibility. I think it's a possibility, and I think one of the reasons that's thank you. I do think that's possible, and one of the reasons that it is maybe even less of a concern is actually the kind of platform that the vaccine is built on. So the mRNA is actually a really simple process that we know when the genetic variants occur, we can use the new genetic code to build a slightly different version of the vaccine. So even though it's concerning that the virus continues to change, that's what viruses do. And this type of vaccine platform might actually be really well suited to keep up with that and to be able to change to better match the variants as they occur. That might mean booster doses. I think it's too soon to tell. But we do know that the vaccine, as it is right now, produces a really sophisticated immunity, and there's multiple places on that spike protein that we're responding to. So even when one piece of the spike protein changes with one of these variants, the vaccine is causing immunity for many places on that protein. And so those are not going to become ineffective just because of one change or even two or three. So it still is a really positive outlook here.
Dr. Haight, again, this idea that this is going to be a regular thing, we should get used to the idea that we will go every year and get a shot?
Again, as Dr. Morris said, it's a possibility, but again, it's a little bit too soon to tell. As we are studying the different variants and the vaccine response, we'll know more as we go on in the future. However, as Dr. Morris also said, the platform that the Pfizer and the Moderna are on, as well as the possible vaccines in the future, they are very adaptable, and so if boosters are needed in the future, these vaccines appear to be able to make those changes and be able to alter enough so that we are able to vaccine against the new variants if needed.
It's going to be important then to have vaccinations against fighting the mutant strains and then stopping them from happening. That's our roadblock to those strains?
Yes, it is a roadblock, and vaccination is a very important part. But I would also like to remind people, if you are sick and feel like you're sick from COVID or even the flu, to really stay home, take care of yourself, contact your physician, make sure we're doing all of the things that we've recommended during this time period, because I will let you know that the number of flu cases is dramatically down just with everything that we've been doing for COVID. So it's a combination of vaccine and then taking care of yourself and making sure that when you're sick, you stay home and not infect other people as well.
Dr. Morris, a couple of things that have occurred to me along the way. We are not being tested before we get this shot. We are told that for every one person walking around who knows that they have this virus, there might be 2 or 3 or 5 or more who don't. If I go and I get a shot and I'm positive and don't know it, Is that shot going to do me any good? Am I wasting a dose of the vaccine?
Nope, you're absolutely not wasting a dose of the vaccine. I think this has really highlighted the importance of knowing more about the immune system and how it works and how it's boosted by different exposures. So by all means, we think that getting a vaccine is the safest way to build your immunity. But if you have natural immunity from having had a COVID infection and you're boosted by another exposure to that protein with the vaccine, your immune system is going to have a second strong reaction and a strong response to protect you from getting infected again. So it's not harmful, it still is protective.
And let me ask you, Doctor, about herd immunity. We have heard this term almost from the beginning. I have heard that it could come by the end of the year if we get everybody vaccinated. I've also heard that it might be 2025 before there is this thing called herd immunity to protect the rest of us. Explain what it is and when it gets achieved.
Well, I really hope it doesn't take until 2025 to achieve herd immunity, but I can understand with the pace of vaccination why it feels like it's going slower. Herd immunity is an important concept because that's when there are enough people protected in the community that the virus can't spread as easily or can't spread at all. I think we have some really good examples from vaccines in the past, things like polio and measles that really just don't happen and don't spread because everyone's vaccinated. If there is a virus that gets out and there's an infection, then usually the buck stops here because the virus can't bounce around. The number of people that we need to achieve herd immunity isn't really clear. It has to do with several factors, including how easy it is to pass the virus around and how effective the vaccine is. So this is a really effective vaccine. We've started off really strong with a great product that can help protect us. And it looks like the COVID virus can spread more easily than we thought, and that's why there are more people who have had asymptomatic infection. The numbers that we've seen have ranged anywhere from maybe 70, 80, even sometimes 90% of the population will need to be immune so we can achieve herd immunity. And obviously, to get there, we're going to have to pick up the pace of vaccination, and everyone is going to have to take a vaccine who's eligible to do that.
That helps, Doctor. Thank you. Teresa, I know you want to remind people about what to do about receiving the vaccine.
Yes, we want to make sure everyone signs up to know when it's available for you. And I want to explain how you can do that because it's different in Columbia and Jefferson City between the two hospitals. Of course, at both facilities, you must be eligible according to Missouri's tiered distribution plan. Again, we are in phase 1B, tier 2. At MU Healthcare in Columbia, you'll need to take a survey. It's quick and easy and it's online. uhealth.org. Just go to the website. You'll see the banner there and click. If you don't have internet access or you need help completing that form, we have a phone number for you to call. It's 573-771-CARE. And if you don't speak English, they can translate for you there as well. That's 573-771-2273, 771-CARE. Everyone can do this. It is not just for MU Healthcare patients. Now, if you're closer to Jefferson City or a patient at Capital Region Medical Center, you will need to call your healthcare provider to sign up for the vaccine. Again, as long as you fall within the state's eligibility guidelines. If you do not have a primary care provider with Capital Region Medical Center, you'll need to establish care first. You will go online, visit their website. It's crmc.org/provider-directory to establish care, and all vaccinations are by appointment only.
The websites and the phone numbers that Teresa just mentioned are posted on our website for you. Just click on our Navigating the Vaccine story at KRCG.com. We've got time now just for some questions that have come in as we've been on air and have come at us rapidly, so we're going to pass them right on. Anybody can jump on any of these as they see fit. We know there are 3 vaccines out there now. The Pfizer vaccine that everybody is familiar with, the Moderna vaccine. These are both 2-dose vaccines. We were told by Dr. Williams today that the Johnson & Johnson vaccine will be coming our way in March, and that is a single-shot vaccine. Some confusion in the minds of many, I am sure. We don't really have a choice, but which of those 3 vaccines do you guys like?
Any vaccine in the arm is a great vaccine, and at this point, all the vaccines are actually a lot more efficacious than we thought that they might be when they were in development. So, you know, we should be dancing in the streets. All of these vaccines are a good choice, and if anyone is offered the opportunity to get a shot, please do not turn it down. Don't wait for a specific product or a specific brand. They're all safe, they're all effective, and the one that you can get is the best one that you can get.
Another question that just came in, Dr. Haight, once I am fully vaccinated, is it safe to socialize with other fully vaccinated individuals outside my immediate pod?
Okay, so again, a very good question. And the CDC is still recommending, especially when you're going outside your usual group, that you continue to wear masks, that you continue to try to social distance as much as you can. And that is because we are, again, looking at the transmissibility from one person to another. And so again, although it appears like in the future the recommendation may change, the recommendation right now has not changed. So again, you would try to still mask up and again try to social distance as much as you can from one another.
Dr. Morris, here's one. If I am fully vaccinated and a member of my household who doesn't qualify for any of the current vaccination tiers contracts COVID, am I required to quarantine?
So unfortunately, yes, you still are required to quarantine. And the reason is that while we know the vaccines are really good at preventing symptomatic COVID infections, that's the outcome that was studied when the researchers did the tests with the vaccines, we don't know for sure if it prevents everyone from getting an asymptomatic infection or spreading it. For you as that person who is exposed, if you don't have symptoms, that's great for you. But unfortunately, right now, you would still have to limit your contact outside of your family to make sure you don't accidentally spread COVID to others. We'll know more about that in the future and as we get more data from following these vaccines over time. For now, the recommendations have not changed.
We'll just keep these going, Dr. Haight. How long after my second dose am I considered immune? How long does that take?
For most of us, 2 weeks after our second dose of either the Moderna or Pfizer is when we're maximizing the antibody response that we're looking for. And so that's generally what we'll say is 2 weeks after the second shot. And that would be true of the Johnson & Johnson about 2 weeks after that, once we do have Johnson & Johnson available to this area.
We know that we don't really know how long the immunity lasts, so do we know when we're all going to have to start over and go back and get more shots? Dr. Haight?
So the answer to that question is we don't know. Again, I think Dr. Morris mentioned earlier that after we have people that have had the vaccine for over 6 months and their immunity continues to do well. With other vaccines, such as measles, mumps, rubella, after you've gone through your series, those continue to go very well. So again, we would expect the same, but as time goes on, as more of us have been vaccinated, we'll know more about what we need to do in the future, whether it's revaccination or if this will be good for all of us at this time. So again, time will tell us, studies will tell us what we will need to do in the future.
Dr. Morris, some people want to know about reaction to the shot itself. We know they keep us sitting around for a few minutes to see if there is anything immediate, but in terms of anaphylactic COVID reactions, when should I expect those to occur? How long before I'm in the clear?
Well, luckily, those types of really serious reactions are very rare, very rare. So some of the data that have been published show that those reactions happen, a few times out of a million, right? So not very often at all. And when they do happen, they happen very quickly. So it's what's known as an immediate hypersensitivity reaction, and that's exactly when it happens, is immediately within a few minutes, and certainly within a short period of time. It's not going to happen days later. It's not going to happen that night when you go home and go to bed. So that's why we recommend observation for 15 minutes for almost everyone after they get their vaccine, and for up to 30 minutes for anyone who has had a serious allergic reaction to maybe a different vaccine or a serious allergic reaction to something else in the past.
Let's talk about expectant mothers or women who are considering getting pregnant. And there's a bunch of questions attendant to that. Should I have the vaccine if I am pregnant? Dr. Morris?
So I provide prenatal care. I take care of pregnant women and babies, and the answer to that is yes. Actually, the state of Missouri considers pregnancy to be one of the high-risk groups that's in the Phase 1B Tier 2, and the reason for that is that pregnant women may be at an increased risk for severe COVID. And so certainly women who fall into those maybe high exposure categories like essential workers, healthcare workers, but just pregnant women in general should strongly consider, I would recommend getting a vaccine because that helps protect you. And you are actually more than one patient. You are two patients, and you're protecting your fetus, your baby, by protecting yourself. So there is not a lot of data about long-term effects, but we actually don't expect there to be long-term effects. Vaccines given in pregnancy are traditionally found to be very safe. The influenza vaccine, for example, is recommended to give to women if they're pregnant during flu season because similarly, influenza can have bad effects on mom and therefore on baby. And the bonus is that a pregnant woman who gets vaccinated, those antibodies will cross over, they'll protect her newborn baby, and if she breastfeeds, they'll continue to protect the baby through breast milk as well.
So there's no prohibition during the nursing period. You don't have to wait until you stop, I would assume. Dr. Haight, I'm running through these as rumors. Will it make you sterile? Can you still have children?
So the answer to that is it will not make you sterile, and yes, you can have children after you have the vaccine. So those are completely unfounded rumors, and so again, we encourage people, if they qualify, regardless of what they are planning for children, to go ahead, please go ahead and get the vaccine.
And people want to know about accessibility down the road. Once everybody has had it once, is it going to be easier to get it? I know that's a crystal ball question, Dr. Morris, but give it your best shot.
Yeah, if I had that crystal ball, I don't think I'd be sitting here talking to you folks tonight. I think that is a great question, and I also think we should trust in our infrastructure, right? So this is warp speed, and it actually happened at warp speed. So I think we need to give some credit to medical scientists for getting this going as quickly as they have, and the supply and demand mismatch that we have right now is purely a product of timing. And I think that in the future, every year we can produce hundreds of millions of doses of influenza vaccine, for example, and in fact we have extra, and we're always looking for folks to give it to. So I think we're going to be in a similar situation in the future, that supply chains will improve and will increase production to be able to meet that demand if we need that for booster doses in the future.
And before we move on, we want to wrap up and give the physicians a chance each to kind of wrap up and give us their final thoughts on the vaccine. Dr. Morris, I will start with you, but I want to make sure I ask this important question. Somebody asked, how much does each dose cost? Are you going to charge me when I get the vaccine? We haven't talked a lot about that quick throughput center at Furrow Field and how that works. Want your final thoughts, but we're not going to ask for money up front, correct?
We are not asking for money. This is a vaccine that everybody, including your state government, your federal government, the healthcare system, everyone wants everyone to get. And so certainly cost is not an issue. No cost.
Final thoughts, Dr. Morris. I took part of your time, but do you have anything else you want to add?
I am so glad that we've had the opportunity to talk about the vaccine in this way and to really get some of those questions answered. I think my job as a family physician is a lot of education with my patients, and I feel really strongly that this vaccine is safe and efficacious, and I'm glad that I've had a chance to dispel some myths and give folks some good information. Now get signed up and get your shot.
And we appreciate Dr. Haight as well. We want to make sure we show people before we leave how to sign up for vaccine availability. So I want to do that one more time. It's different between the two facilities. So if you are in Columbia, you're going to go to the website at muhealth.org. If you don't have internet access or you need help completing the form there on the website, you want to call this number. It is 573-771-CARE. That's 573-771-2273. And remember, signing up for vaccine availability, that's open to everyone. You do not have to be a patient at MU Healthcare to do that. Getting the vaccine, if you're closer to Jefferson City or a patient of Capital Region Medical Center, here's how it works. You'll need to call your healthcare provider to sign up for the vaccine. Again, as long as you fall within the state's eligibility guidelines, if you do not have a primary care provider with Capital Region Medical Center, you will need to establish Care First. For help finding a doctor, go online. Their website is crmc.org/provider-directory. All vaccinations are by appointment only, and we sure hope that you sign up for the vaccine survey. We appreciate all the great information for our community tonight, and thank you to KRCG for doing this.
All right. As it always seems, this conversation has flown by too quickly. We have run out of time. Dr. Morris, Dr. Haight, thank you both for making yourselves available tonight, and maybe we can do it again somewhere down the road. To those of you watching, thank you for your questions. Keep them coming. We have a team of doctors still hard at work getting you the answers on our Facebook page. So on behalf of Teresa Snow and myself, we want to thank MU Healthcare, Capital Region Medical Center, for their partnership in this vaccine special. We hope this information has been helpful for you to make decisions for yourself and your family. Final thought, Teresa?
As a doctor, my superpower is saving lives.
I may not wear a cape, but I do wear a mask.
In the cath lab.
When I'm out shopping.
Taking my kids to school.
Getting my morning coffee.
Dropping my daughters to dance.
Now it's your turn to be a hero.
Mask up and help us slow the spread of COVID-19 in mid-Missouri.
You can save a life too.
So let's mask up, mid-Missouri.